Before stroke was ever part of her story, Tina Orkin was the one caring for everyone else. She worked as a certified nurse practitioner in OB-GYN, guiding women through some of the most vulnerable and powerful moments of their lives. She was a Lamaze teacher, helping expectant mothers prepare for birth with confidence instead of fear. She was a mommy and me educator, building community for new parents who were trying to find their footing. Her life revolved around supporting women, advocating for them, educating them, and making sure they felt heard. Then in 2016, the caregiver became the patient. Her first stroke did not come with immediate answers. The signs were there, but they were misread. She was initially misdiagnosed, a reality too many women face when symptoms are brushed aside or labeled as stress or anxiety. That experience didn't just impact her medically, it changed her perspective. It sharpened her voice. It lit a fire in her to speak up for women navigating hospital systems that do not always listen closely enough.
That has to be frustrating.
It is, especially when you've spent your career advocating for others. Recovery became her full time focus. Rehab was not optional, it was daily, demanding, humbling work. Relearning movement, rebuilding stamina, wrestling with fatigue. She was fortunate enough to participate in a clinical trial using the Motique C-mill, an advanced treadmill system designed to retrain gait and balance through immersive, brain challenging exercises.
That's serious training.
It is, and she attacked it with discipline. Slowly, she regained strength and independence. She built momentum again. And then, 6 months ago, another devastating turn, a second stroke. This time, she lost much of the progress she worked so hard to achieve. But she was not the same person she had been in 2016. She understood recovery. She understood her brain. She had the tools and strategies and the experience on her side.
She knew the road this time.
Exactly. And because of that knowledge, her progress moved faster. Not easier, but more intentional, more informed. Tina is not only a two-time stroke survivor, she's an advocate, especially for women whose symptoms are dismissed or minimalized. Her story is layered with resilience, but also with accountability and awareness. Tina, we're honored to have you with us today. Hi, Tina. We're really glad you're here. Thank you for sitting down with us.
I'm really happy to see you today.
Nice to meet you. Thank you.
Absolutely. So before we jump into anything specific, I just wanted to shift the lens for a second. We've already talked about the strokes themselves, the timeline, the advocacy, the work you've built since then. We've touched on rehab and the recovery process in a broad way. All of that gives people context, but context isn't the same as experience. What we haven't done yet is slow it down and really sit inside what it was like for you as a person, not as an advocate, not as a survivor people look up to, just you in it. Because when something like this happens, it doesn't feel like a headline. It feels confusing, feels lonely at times. It feels physical in ways people don't expect. There's the hospital, the waiting, the rehab, the room, the exhaustion, the tiny victories that no one else sees. Rehab isn't just appointments and therapy sessions, it's frustration. It's repeating the same experience over and over. It's wondering if this is as good as it's going to get. It's relearning parts of yourself you never thought you'd have to think about. And I think that's hard for people to hear. So instead of us leading through your milestones, we just want to give you the space to tell like it actually felt from inside out. And as someone who taught, led, organized, and advocated, how would you describe your identity before June 2016?
Before the stroke, I was a nurse practitioner in OB-GYN. I worked the floor as a nurse. I taught birthing classes. I taught mommy and me and parenting classes. And I worked at USC as the associate vice president of parent programs and Greek life. I was used to being in charge, getting a million things done, all on my terms. I did a lot of volunteering. I like for a lot of different things. And I was a wonderful grandmother who could do everything. And all of that changed on June 10th, 2016 at 12:01 noon. I know to
Uh,
the minute.
I'm sure. Yeah. So, as a medical professional, did you ever think a stroke was something that could happen to you?
No, I didn't because I had met all the blood pressure markers and the cholesterol markers and the risks that you're warned about. I was very up to date on all my yearly medical exams you're supposed to do. So I thought wrongly I do everything I'm supposed to. I'm healthy enough, like, couldn't happen to me.
Mhm.
Of
I
course,
was wrong.
no one thinks it's gonna happen to us. That's right? I mean, that's the truth.
Yes.
Mhm.
Yeah.
Yeah. You feel healthy, and so you don't double check.
Yeah.
Mhm. So you knew something wasn't right. So what did it feel like inside your body?
Well, I'm gonna give you a little bit of the history so you can see. So at about 12:01, I felt weird. I felt a little dizzy. I felt unsteady. And I thought, oh, it's lunchtime. I must be hungry. Funny enough, I was working on picking a health plan for my husband's business for the employees, looking through health plans. And I thought, I feel weird. I went downstairs, I made something to eat, and then I don't know why, but I went into the bathroom and did a neuro exam on myself. I'm a nurse, so I knew how to do that. And I didn't really have too many markers. I wasn't drooping. My face wasn't, down on the one side. I called my husband and said, can you understand me? He could understand me, so I didn't have any speech changes. And I took my blood pressure. I don't know why I thought to do it, but I did. And it was high, 160 over 90, which is very high for me. I called my daughter, who lives close by, and is a doctor, and I said, "I feel really weird," but I didn't feel like anything was enough to go to the ER. So she picked me up and said, "Well, at least if you decide to go, you're not gonna be alone." So I was at her house, and it felt like my brain was moving in my head. I just
Mhm.
felt weirder and weirder, and so we went to the ER.
So when you went to the ER, you didn't have any speech problems, there was no other
No,
issues, what you said?
I walked in to the
Mhm.
ER, and I told them, "I'm either having a heart attack or a stroke, but I don't think it's a stroke." And so
Mhm.
they got me back there quickly, which was good. They usually do if it's that type of emergency, and
Yeah, I was
did a
wondering
CAT scan.
how quickly they admitted
Yeah.
you.
A CAT scan will only show you a hemorrhagic stroke or a bleed. They did
Mhm.
an exam and then did a neurological exam with a neurologist over telemedicine. And they decided that I was having an abnormal migraine headache. Well, if it
Okay.
was an abnormal migraine headache, this headache has lasted 10 years and isn't leaving anytime soon. So, I was like, "That doesn't sound right," but I was relieved. If it was a headache,
Yeah,
something I
then
recognized
it's
and
a
I could
headache.
Yeah,
deal
I
with
mean,
that.
yeah, these are the
So,
doctors telling you.
yeah, that was fine. I'd rather have a headache than a stroke. So they said, "We'll bring you to the floor just for observation." So we go to the floor, and I needed to go to the bathroom, but I couldn't move. That's the first time I realized I was paralyzed. So I rang my bell and said, "I need to go to the restroom," and the nurse said, "Okay, go ahead." I said, "I can't move, I'm paralyzed." And that's when they kinda started to listen to me. And that's when they finally, 5 hours later scheduled the MRI. But what they didn't do between 2 to 3 hours was give me the clot busting medication,
Right.
Right, so
TPA,
That's
the
what you
because they
TPA,
didn't
yeah.
right,
think it was a stroke.
right.
Mhm. How did it feel to arrive within the treatment window and still lose access to the TPA?
I was pissed.
I'm sure.
Yeah,
I
of
was
course.
really
Yeah.
mad. Um, but again, when they told me it was a migraine headache, I said, "Well, that's great. That's wonderful."
Yeah,
So it was afterwards when I realized I had had a stroke and they did the MRI that I was very angry.
yeah.
But
So
I decided this was a choice that I was gonna put my energy into getting better and not holding on to that because stroke takes a lot of time and energy for recovery, and I only had energy for one thing. So I didn't do or pursue anything with the misdiagnosis.
mhm. Do you believe that your outcome might have been different with an earlier MRI?
Yes, but there's no way to prove it because sometimes TPA does not work, and there's no way for me to know if it would have worked in my case. But I wasn't given that option. So what happened then was they did do an MRI. Finally, after 5 hours, I happened to know the radiologist at that hospital, and I said, "Call him in." They said, "He's never coming in, he went home." I said, "Call him in." They go, "He won't come in." I said, "Call him and just see." Of course, he came right in, he did the MRI, he read me the results himself. Like, he didn't even go in another room, and he told me I had a major stroke in the right basal ganglia. As soon as we heard that, both my daughters did their residencies at UCLA. They started texting every person they knew in neurology at UCLA to get me to UCLA because there was a procedure that was fairly new then where if there was a clot still blocking, they could go in and retrieve it surgically. And UCLA was the only place that did it at that time. Now a lot of places do it. And they knew there I would get excellent care. At a local community ER, they don't have residents or interns, and your doctor may or may not be there. There was
Mhm.
no doctor at the hospital. So at UCLA, there's doctors everywhere.
Right.
So
Mhm.
they called everyone they knew and finally got me a room and a bed, but it took 5 more hours for them to transfer me
Oh, yeah.
because we're not sure why, but my husband went out to the desk and yelled loud enough to get attention, but not loud enough for the guards to kick him out.
Yeah.
Somebody come here now, like, she's paralyzed, you're not
Yeah.
doing anything. So
Mhm.
finally getting the ambulance, cute paramedics, by the way. That was the only plus, is that I got to ride with cute paramedics, and I
Lucky
want to
you.
know if they need to turn in headshots to get a job, because all the paramedics are so cute. So I have to ask one of them. At UCLA, things went in warp speed. Another MRI, millions of doctors in and out, and people talking to me and telling me what was going on, very different than the other experience
Yeah,
in the
so you
other
were getting a
hospital.
lot more information there.
And attention and care, yes.
Mhm. So, as someone from the medical field, did this change your view of the emergency medicine?
It changed my view of medicine in general. Now, when I worked as a nurse practitioner, I had my own caseload, and I was very careful to listen to my patients, and I think that's the key. They weren't really listening to what I was telling them. They
Mhm.
made the assumption, "She's fine, she walked in." They do a neuro exam in the hospital every hour. They show you this picture of a woman by the sink with water overflowing out of the sink and a little boy on a stool trying to get into the cookie jar, and they wanna see if you have the cognitive awareness to describe it. So about the 11th time I said, "Get that kid off that stool, he's gonna break his tibia," they stopped showing me the picture because they made assumptions because I could do that, that I was okay.
At that point, nothing had happened as far as your speech or anything.
Nothing at
Everything
that point,
oh,
not
yeah.
yet.
So, you believe that your symptoms were minimized because you were more coherent and speaking clearly?
I believe it's not that they were minimized, they weren't recognized,
Mhm.
and they thought, "Oh, she must be okay." And I understand that, but I also feel like they're so busy and rushed. I mean, the ER doctor was nice enough. It was like negative CT, talking. She walked in, she's fine, versus not waiting long enough to see what symptoms were developing, which they were.
Yeah.
And they still sent me a bill. That
Of course.
irritated me, but I didn't pay it.
Of course.
Good for you. Yeah. So in some ways, they did underestimate what you were going through.
Yes.
Gotcha, yeah. What do you want women to understand about advocating for themselves in the ER?
Okay, well, there's a wonderful book that can explain it even better called Diagnosis Female by Emily Dwass, DWASS. And it's about how medical bias under diagnoses women. And it's got like 22 patients with different cases. I am chapter 2, and it's got a lot of examples of how women, don't have typical heart attack symptoms, might not have typical stroke symptoms, might have symptoms other than men. And I
Mhm.
think that that happens quite a bit, not just in the ER, but in general. You
I
need
think
to
so.
advocate for yourself as much as you possibly can. I was lucky because I had my speech and my cognitive awareness. They say I still have a brain. So I was able to advocate for myself, but not everyone can do that. So you need someone who can do that for you.
Which is what I had. I had all my family, my wife, I mean, and they were the advocates,
Of
and
course,
I
you
I
need that.
oh, yeah.
Mhm.
Well, yeah, but when I was in the hospital, though, I
You
felt
couldn't speak and
I
you were
couldn't
yeah,
speak, and I fell apart. I was,
out in a coma.
I was out in a coma
Weeks, 5
for
weeks.
5 weeks.
Mhm.
So you needed someone to do your advocacy for you.
Totally, yeah.
Yeah, yeah, he needed our voices in the hospital, which again, whether it's yourself or whether it's your family, you need someone to advocate for you.
Absolutely.
Yeah. So was there a moment that you realized recovery would be a marathon, not a sprint?
Um, yes, and I realized that early, although many people don't, because you're measuring change and recovery in such different terms. You break your leg, you know it's 6 to 8 weeks, 2 weeks of pain, 2 weeks of more discomfort, 2 weeks of get this, like, arm thing off of me, and then slowly doing better. A stroke doesn't work like that, and no 2 strokes are the same. If you put 2 broken arms together or appendicitis, there'll be a similar pattern of recovery. Stroke can move an eighth of an inch and have a very different effect. And so because the effects are so different, your recovery will also be different. And I think about halfway into that year, that first year, I realized that this wasn't gonna follow the same pattern of other types of recoveries. And what I viewed as a really positive, other people wouldn't understand, like being able to step on an escalator and not fall off. You have to use your core, you have to use balance, you need the use of your leg and an arm. And if you wanted to carry a bag on that escalator, it's even harder. My PT had told me, I want you to, this was my homework, I want you to go shopping. I'm like, oh, great. So I
Yeah,
told
good
my husband
tangent.
we had to go to Nordstrom's for PT and buy something with a bag that was fairly heavy and go up the escalator.
Mhm.
So most people wouldn't think anything about stepping on an escalator. Killing a spider moving on the floor.
Oh,
Seems simple every day, right? Well,
Mhm.
after a stroke, it's not. You have to be able to stop the spider with your foot or bend over and get it and get back up without falling. So your like sites and steps that you're going to count as a positive are way different than normal. And within all that, you have doctors, nurses, PTs who may be inadvertently standing in your way. At 3 months after the stroke, I went to see my neurologist for the first time. Now, everyone, it's kind of like a little rule. At 6 months, you'll get the most recovery. At a year, you'll get the majority, and then
Right.
it's slower. At
yeah,
3 months, he told me, and I was just out of the hospital, "You'll never be any better than this."
Yeah.
I'm like,
uh-huh,
"What? I shouldn't go to PT? I should sit on the couch and eat bonbons?" He said, "Oh, no, you misunderstood me." I said, "Oh, good. What do you mean?" He
Yeah.
goes, "Well, you're not gonna get any better than this," but I could have said it better. So I suggested he work in the morgue
Good
or
idea.
pathology and not talk to live people,
I hope
and,
he listened.
went by what my PTs told me, which was
Mhm.
very different, and I made great, great progress since then. At that time, I was not walking well. I was using a walker or a cane, and I went to not using any, implementation to help me walk, and I wanted to send him pictures, but he left the where he was working, so I couldn't reach him. I
How lo
wanted to show him, like, "You were wrong, buddy. Don't do that to patients."
Right.
So
How long did that take, before you really thought that you were able to walk again and
Without the
I
walker.
was walking in about 4 to 5 months without help.
Oh, great.
I think it's really important that you build your team depending on what your needs are. So my team was my neurologist, my
Mhm.
PT, my OT, and I also went to speech. Because what you asked, Roger, about speech.
yeah,
In the very beginning, my speech was very, very slow, monotone, and boring. I used to teach 2-year-olds, so that wasn't gonna work. I would bore them to death. My joke was I could go into putting people to sleep by talking to them. I could have a side business. But I worked with speech on that and was able to get back some intonation in my voice, but it took about a year
oh,
Mhm.
okay.
to get that fully back.
To get it fully back, but okay, but it didn't really affect, it just affected
Actually, pronouncing
the
words.
pronouncing and things like
Yeah,
that.
it didn't affect, my ability to express myself.
Did it affect your reading at all?
My reading was more affected by some sight issues. So now I only read on the Kindle where I can
Mhm.
make the words bigger. So there's about 4 words on the page and I go to the next page
Yeah.
because I have something with my eyes. But I love to read. Before that, I would read like 2 to 4 books a week, and it was harder to do that after the stroke.
I mean, my reading is, I don't know the difference between it B's, D's, and P's. So
That's hard.
yeah, so when I get to different when I get to different letters, then it really so in the beginning, I couldn't read anything. Now, if I wanna read a book or not a book, if I wanna read an article, um, that would normally take anybody, like 10 min like, 5 minutes or so, it would take me 20 minutes, 25 minutes, 30 minutes.
Mhm.
So it's getting better and better, and mine is 9 years,
Yeah.
so
Those are things people don't account for when they
Mhm.
ask how you're recovering. They'll say, "Oh,
Exactly.
you look good. Oh, you're walking." Well, they don't know that to walk, I have to think, lift my foot, put down my heel first, go heel to toe, don't lock the knee, and don't lean too much forward. They don't know that. They just see the final part of it. And people don't know that you may be thinking, okay, what's the word I want? I'm really tired. My brain's tired. It might take me longer. They don't see that part. The other day, someone told me, "Oh, your hair looks great." So I thought, okay, I'm getting a t shirt. My walk is funny, but my hair looks great. I mean,
Yeah.
it's nice that my hair looks great, but they don't know I had to use special things to do it with one hand. I can't use
Right.
the other hand,
Uh-huh.
and that it took 2 hours instead of 40 minutes. So people just see what's outside. They don't understand. But I do recommend no matter what happened to you, you build a team that you trust, who's gonna help you through, and if you don't like someone on that team or they're not working for your best interest, get rid of them. I have fired more than one doctor,
Yeah.
and
Yeah.
both my daughters and son-in-law are doctors, and when I have an experience like that, like saying, "You're the best you'll be," I call them and yell at them. "If you ever treat a patient like this, they're 40 and 44. You're
Yeah.
grounded." I tell them, "You may not do that as a physician. I
Mhm.
paid for med school, you follow my rules."
Right.
Because I think it's easy to get distracted and forget that patients are people, and
Exactly.
you wanna
Yeah.
be treated like such.
Feel like it could be like that in any, profession, but being a doctor, I feel like that hits more. What does independence mean to you now versus before your stroke?
Well, it's funny you should ask that. We were just talking about other things in your life. So your stroke doesn't happen in a vacuum. Since the stroke, I've had 2 knee replacements. I've had multiple other issues, including a second stroke 6 months ago, which was a bleed instead of a block, hemorrhagic instead of ischemic.
Mhm.
So that changed everything. I was quite independent, could live a pretty good one-handed life, and that kinda wiped all that out, and I had to start from scratch. So independence can vary depending on what you wanna do and where you are. I wanna be able to enjoy my grandchildren. I wanna be able to go to book group. I wanna be able to attend classes that I want. Most of that I do by Zoom now because getting there is hard. My biggest thing is to go watch my grandsons, there's 4 of them, 1 granddaughter in there, play baseball and basketball and football and run
right.
track.
Yeah.
It's a good thing they don't golf, it would be too much. But I like to do that, but I have to
Mhm.
count on someone to get me there. I have to try to, manage the uneven land and the cracks in the sidewalk and the grass growing through it to
Yeah.
try to get to the seating. But that to me is some independence. Before independence was I could do what I wanted. I drove my grandkids. If I wanted to go to a movie, I would. I didn't have to depend on a ride from someone. I didn't have to wait for a lift to get there. Didn't have to worry about my wheelchair. And I didn't have to worry about where I was going. Could I get into that house? Were there stairs? They didn't have a
Mhm.
handicap bathroom. Would I get stuck on the toilet and not be able to get up?
Yeah.
Where's
Right.
the toilet paper? Did I sit down and it was on the wrong
On
side?
the other side, right.
S Right?
Yeah.
So now
Mhm.
you
Yeah,
have to think
exactly.
of
I
all those
understand that.
things. Is
Yeah.
someone in the handicap restroom on the phone? And you can't really
Absolutely.
yell at people in the bathroom, but you're like, really? Every stall
Yeah.
is empty but the handicap, and you had to use that one? So,
Mhm.
you don't have control. I don't have control of certain things, which is big for me, and I don't like to ask for help. I'm really bad at that. So, I've
Mhm.
had to learn patience, a lot of patience, and I've had to learn it's not a weakness to ask for help. Sometimes you're trying to get through a door and every bathroom doors, why are they so heavy? Like, they're so heavy, you need, like,
Yeah.
2 hips to open them. And I
Mhm.
used to, like, not ask, but now if someone's coming out, I'll just say, "Will you hold that for me?"
Yeah.
And usually people are more than happy to help you
Oh,
Yeah.
if
absolutely,
you
yeah.
give them the chance, but I didn't wanna show that weakness, and I have a 20-minute rule. If I'm struggling to get my shoe on, my shirt on, whatever it is, please don't jump in to help me right away. Give me a few minutes to try to figure it out. Then after 20 minutes, you are allowed to help me. Because maybe I can figure it out, and maybe doing it myself will be the way I'll figure it out.
Because maybe it'll be
So
that time.
right, so, don't be afraid of help, and don't be afraid to guide help as you need it.
Mhm.
So, independence change, and then after the second stroke, I'm not as independent as I was a year ago, because 'cause I'm back to walking with a cane or a walker. I don't like it.
Let's talk a little bit about the Motic C mill. After years of traditional physical therapy, what did it feel like to try something new like the Motic C mill?
Okay, that's a very good question because I'm very into all the latest research going on for stroke recovery. About 9 years ago, they had a stem cell study. They had very good results of stem cell transplants. It was a hard study to get into. I got into it at UCLA, but it didn't work. It didn't work with anybody in the study. So I decided then I would do any type of new product that was not invasive. 'Cause
Mhm,
I
right.
don't need another hole in my head, like a hole in my head.
Yeah.
So,
Was
when
enough.
the C-mill came up, I do my therapy at Northridge. I'm on their advisory committee, and they asked me if I would demonstrate it for the press. It was amazing to me because when you look the C-mill shows you in real time what you're doing, so you can see in the mirror exactly what you're doing versus the mirror just watching you pick up your foot and not end the step. And my PTs were telling me that I circumvent or bring my foot out when I walk, like bring it out in a half circle and around. I was like, "No, I don't. Look in the mirror. It doesn't show that." Well, in the CMAL, it shows that exactly. And once I saw that, it was able to register in my brain, yes, you do that. I couldn't see it in a regular mirror. So a lot of this new technology, there's a lot out there. There's Movis Notum, which now helps you move your ankle up and down and move your arm. There's, the vagal stimulant. There's a bunch. I'm into all of it. It's worth trying, and a lot of insurance and Medicare covers it, and I figure if it doesn't work for me, I'll try the next thing,
Right.
except for a hole in my head, but the
Exactly.
C-mill made a big difference because I could see what I was doing. It was like watching a movie versus a still shot where you couldn't see what you were doing. I think those things are great, and I'm glad somebody 10 years ago did a research study to find this product. I do Botox in my arm. I don't know if you're familiar, but they use Botox specifically
Right.
for arm tone and spasticity. So a lot of people with stroke, you'll see their arm like this, like it's frozen. My stroke affected arm on the left lays flat. And the reason it does that is because of Botox. You can do it I do it 4 times a year, and it gives you that relaxation enough to do your exercises and use a brace enough to have that continue. It also makes my hands look very young. So when you look at my
Nice.
hands, the stroke hand does look about 20 years younger. I can now become a hand model.
That's what I was gonna
So
say.
it absolutely works, and he said I could stick my face in if I wanted. But again, that's only because somebody did a research study on it 10 years ago that I can
Yeah.
use it now.
Mhm, very innovative, yeah, and how lucky you were to be able to get into that trial.
Absolutely.
And then this is not now, going forward, like, about 4 months ago or 6 months ago, you had
Yes.
another stroke,
Yes.
and what happened on that one?
Well, that was really strange. I was getting ready to go to my neighbor's daughter's graduation from middle school,
Mhm,
and I went to get dressed, and I couldn't get my dress off the hanger. I finally got it off, and again, I felt weird, and I felt I was walking really slow. I made it to the sink where I have a little stool to sit on. I don't know how I did it. and then I went to stand up to put my dress on, and I couldn't stand. And so, obviously, something was wrong. I called 911. I thought, "Oh, cute paramedics, let's call 911."
Were
And
you home
then,
alone?
I was alone.
Uh-huh.
I called my caregiver who had left about 15 minutes before, and I knew she lived close. I said, "Could you come back?" So she knew how to get in the house. She came back. Meanwhile, I had called 911. I said, "Get my medication basket out so they can see it." I knew what they would look for. So they came. They said my blood pressure was high. It wasn't that high. It shouldn't have be high enough to cause a stroke. But they took me to UCLA West Hills, where they right away did a CAT scan, and then that showed the bleed. Fortunately, it was a small bleed and it blocked off, also in the basal ganglia on the opposite side. Now, that should have caused my right side to be affected because the side of the stroke affects the opposite side of the body, but it didn't. So everyone was very baffled, like, what is going on? But my personal neurologist, who I emailed at 2 in the morning and emailed me back at 5, that's why I keep him on my team,
Yeah, he's on the team.
said
He's a
he
keeper.
thought that the bleed had wiped out all of the new pathways I had formed from the other stroke, and that's why it still affected the left side. And the doctors were all confused because they thought my weakness was all from the original stroke. I knew it wasn't because I had gotten back so much, but it took a long time to get someone to listen to what I was saying, that I could do that yesterday, I just can't do it today. It's not from the original stroke. So I had to start from scratch.
Yeah, so I was gonna say, so what part of your progress did you feel like you had lost when you just had this recent stroke?
Well, I couldn't move my leg, I couldn't move my arm, I couldn't move again. I was back to square one, but I was able to progress quickly because I knew what it took. I knew how hard it was.
You had all
I
the
knew that
tools
you
down.
really have to work in your PTOT because I had done it and I had learned the little knacks and lessons on what to do. But emotionally, it was very hard because I had done this already. Why do I have to do it again? And it hit a part of my brain where the emotion was. So I was like a crying mess.
But this
Um,
one didn't affect speech at all.
of what it did with speech, but we didn't know for a few days, is I didn't have a lot of power behind my voice. It made me sound very hoarse, and I would run out of air, like in the middle of a sentence. You can still hear it a little bit. So I went to speech and worked on that and had these exercises to work on. So it affected speech in the way that not aphasia where I couldn't get the words, but I couldn't get the words out because I didn't have the power to do it. I can't speak in a like, with a big group of people, they don't hear me. Even my grandkids, I'm yelling their name. Now with the grandkids, you can't tell, maybe they just don't wanna talk to me, I don't know.
Yeah.
And I'm like, "Sean, Sean, Sean." And I'm like, "Can he hear me?" Or he just and then he'll turn around. I
Yeah.
never know that was they ignoring me or they can't hear me.
Yeah.
I'll never know, it'll be a secret.
What frustrates you most about how strokes are understood?
Um, well, one of the things is there's very little understanding of how the recovery goes. People assume, "Oh, that was 8 weeks ago. That was a year ago. That was 2 years ago. Why aren't you okay now?" There's a lot of things you can't see with stroke. You can't see the mental struggle of not being able to, always keep up with the conversation. You're in a wheelchair, you're down here, and everyone else is up there, and they can't hear you even if you want them to. I'm going to a conference in a few weeks and speaking there. They asked me to come and speak, but when they made their room blocks, they didn't block out any handicap rooms. Now they've asked me as a guest to come and speak. I called to make a reservation. They said, "Oh, there's no handicap rooms." Well, I have a big mouth. I called the people in charge. I said, "You're having me come and talk about the challenges of stroke. Should this be my first example
Yeah.
that there's no handicap room?"
Uh-huh.
And that was fixed right away, by the way. But those kind of things, I've gone to I mean, when I have a handicap room, I'll explain I need a stall shower, not within a bathtub, and a chair on the shower. And I'll call every week to remind them, and I'll get to the room, and there's a chair in the bathtub. Now, if I could climb in the bathtub, I wouldn't need a chair. I
Exactly.
can't get in the bathtub. So,
Mhm.
and it's not to be mean or
No,
to
of course not.
be, discriminatory. They just don't
They don't
understand it.
under people don't understand is really
They
what it
don't.
is.
Mhm.
You
Yeah.
go
Yeah.
into a handicapped bathroom, the toilet's supposed to be high enough for a transfer from a wheelchair, and you go in and you know it's lower, and you only find it out when you sit down and you can't get up.
Yeah.
And
Yeah.
then I'm trying to use my cane to unlock the door so someone could come rescue me.
Oh my god.
They don't understand. In a restaurant, I'll say, "I can't sit on a high chair. We need a regular table." Happy hour, you have to sit in the bar area. They're supposed to have one handicap table. They
Mhm.
don't always. And if you sit next to the bar, they won't serve you the bar menu because
Right.
you're not in the bar.
Not the bar,
Things
right.
like that where they just don't get it. You
Yeah.
go to a friend's house and you have to navigate where you're going. You go to a restaurant. I pre-look up. Where is the parking? Even if it's handicapped, how close is it to the door? How far is the table from the bathroom? Would wheelchair be able to maneuver? Is the parking lot uneven? Going to a baseball game, do you have to go up the hill to the top field? So, it's a lot of pre-planning and thought, and people and even, like, your family members may not understand, "Roger, you've been doing this for a while, why aren't you better?"
Yeah.
And
Well,
it's not to be
they look
mean.
at you and, you look okay, that's the
Yeah,
problem.
that's what people say, "You look
You
good."
look
Mm.
fine, so,
"Well,
that's
I
the
wish
whole
my brain worked better."
yeah,
Yeah. I wish your brain looked as good as
yeah,
you look.
that's
Yeah.
what that's I feel, yeah, exactly.
One week, I had to have a heart scan and an MRI in the same week. So they proved I had a heart and a brain. I said, "Okay, give me some courage. I'll see the wizard." I mean,
That's what I
you
yeah,
know,
go down the yellow brick road.
right. Well, if I had the courage, then maybe I'd recover faster. But there's certain things you can't change. And by the way, you can work extremely hard and do everything, and you still might not have the recovery you want. You'll have improvement, but you still may not be out of the wheelchair. You still may not be able to walk without assistance. And people assume it's because you didn't work hard. And it's not. Working hard will give you more than if you didn't, but it may not guarantee complete recovery. And I've had to learn to be okay with that and put my time into other things than that. I also think it's okay, and Roger, if I didn't invite you, I will, to have a pity party once a week. It's okay to say, "This sucks. I don't like it. It's not fair. I have balloons at my party and food on Tuesday, half hour, and then you're done, and you have to go back and work at PT." But it is okay to say, "This sucks." And some people will tell you it's not. But I think it's okay to express that this is, I won't say the words I wanna say, but it's not fair. And I wish I could drive my grandkids around,
Mhm.
but I can't,
Yeah.
so I
Yeah,
try to do other things.
Yeah, it's not
"Roger,
what
come next Tuesday, it'll be fun."
yeah. I
exactly.
think you could definitely use a little pity party.
Yeah, yeah. You try not to, but it gets there
Right, you
sometimes.
should,
Yeah, you
though,
try not. Yeah,
Mhm.
but you can't do it to the point that you don't do your work of
right.
what you need to do.
Can't do what you wanna do, yeah.
Exactly, and like we've said previously, it's number one you need to remember is that there's no plateau, and that's really been our strong message from the beginning that we started this podcast, is that's we wanna
And
spread
no 2
that.
strokes are alike.
Yeah, and no 2 strokes are alike, exactly. So, before we finish this off, I just wanted to see if there was someone in the ER right now and something feels off, what would you tell them?
I would say ask questions. If you can't, make sure whoever's with you knows what questions to ask, medical or not. Have someone do it for you, and don't be afraid to call in any favors. Your neighbor's a neurologist, that's the day I would call him.
Yeah, take advantage of that.
Like, my daughters called every person they ever met at UCLA to get me a bed and a room, and that's what did it. And I think that's okay. I mean, I try not to pull favors, but life and death, it's okay to pull favors. And
Absolutely.
maybe have for your loved ones if they're not. I mean, I'm lucky my daughters are doctors, my son-in-law's a doctor, my dad was a doctor, so we have a lot of medical people who know
Mhm.
what to ask besides me, but maybe have some basic questions for them. And in advance, you can find out who has a level 1 stroke center at their hospital, who's the best for heart attack? Who's the best for whatever might come up
Right.
so that you know where to go. Know where there's places you can look up the wait in the ER. The ambulance will take you the closest, but it may not be the fastest.
Might not be the
So if
best
you're
Or the
one.
going
best
by
one, yeah, that
yourself,
yeah, it's gotta be the best
look it
place.
up, ask your regular doctor, "Should I think I'm having a heart attack or a stroke, where would you recommend I go?"
Yeah.
So that you have some information, and then at that point, you need to also trust in the health team.
Mhm.
Because I didn't go to medical school, so I can't claim to know that. My closest to medical school is Doctor Google, who
Right.
I'm a very good friend of,
Like
and
most
my doctor said, "Please don't let my MD interfere with your Google search." And so don't fall down that rabbit hole. If you're
Yeah,
gonna look on Google, look on, like, the Cleveland Center, University of San Francisco,
yeah.
reputable
Very
websites.
accredited universities and yeah.
Yes, and pre-think of what questions so that your loved ones can ask them if you're not able, and if they don't have the medical background, like the rest of the people in my family don't. So, I tell my husband, "Here's what you need to ask." He's an accountant who asks, "What's the bill gonna be? How much is it?"
Yeah.
But he
That's his
might not need
question.
to know to ask CT or MRI. So everyone has their skill set.
Mhm.
But then at a certain point, I think you have to put a little trust. You're in a coma, you can't do that. You have to trust someone's gonna help you. I appreciate being able to express what happened to me, and I hope the people listening maybe learn some things to question and to ask for themselves as well.
I definitely think they will.
yeah.
So thank you very much.
No, we really
Thank you.
appreciate having you today, and,
Anytime.
Yeah.
yes.
No, and so we'll talk soon. Thank you again.